Well, hello everyone. My name is Milena Sergeyeva. Welcome to this panel. It's my honor to welcome our panelists and all of you from different regions to now focus on the Latin American and the Caribbean region. It is a tapestry of cultures and ecosystems that are all being affected by the challenges of loss and damage, the health of the populations, their livelihoods, their cultures. So this is what we're going to focus on. And I'd like to just introduce the organizations who have been behind this, the organization of this panel, this session. This is the Latin American Network on Climate and Health that was convened by the Global Climate and Health Alliance. I work for GCHA, the Global Climate and Health Alliance, as their representative in Latin America and the Caribbean. And this network brings together organizations, health organizations who work to address the challenges of climate that are posed to the health of the populations and to leverage the opportunities that exist in climate action for health. So these are organizations of doctors and nurses, also research institutes on climate and health, also emergency doctors and nurses who are volunteering and running to tend to communities after climate disasters, and also people who work on access to health and intellectual property, access to treatments, and they are from all around the region. And some of the organizations are on the panel. And also some of them have prepared for you a video that we're going to show you to get us started with this event. And then I'm going to pass the moderation on to the caring hands of our family doctor among us, Dr. Paula Rava, who is representative of the Ibero-American Federation of Family Doctors. All right, so let us start with the video.
Julio Crisóstomo, ese es mi nombre. En este momento es lamentable el caso. Podemos ver cómo tenemos esa destrucción que, bueno, solamente Dios nos puede ayudar. No tenemos dónde vivir, no tenemos otro lugar a donde ir y tenemos que soportar la situación de esa manera.
Hola, bueno, me presento, soy Iván y soy un agricultor de la zona. De esta forma, como ustedes pueden apreciar, está nuestro bonito valle, así está de seco, ya no hay animales, ya prácticamente parece un verdadero desierto.
Una de las problemáticas que presentan las comunidades indígenas cuando están en épocas de lluvias intensas y lluvias tormentosas, que ahora estamos en esas épocas, es que ellos consumen agua de las quebradas y de los ríos. Entonces, cuando hay una creciente de los ríos y las quebradas, bajan sucias y ellos toman de esa agua. Entonces, presentan varias enfermedades como las enfermedades diarreicas por el consumo de aguas sucias.
Los eventos climáticos afectan los determinantes sociales y ambientales de la salud, incrementan el riesgo de la enfermedad y generan una mayor demanda de servicios de salud.
Vim conversar com vocês sobre um tema extremamente importante, que é a questão da saúde mental e mudanças climáticas. Primeiramente, considere que um trauma infligido por eventos climáticos extremos, como furacões, inundações e incêndios florestais, estão se tornando cada vez mais frequentes e severos. A destruição de lares, comunidades e meio de subassistência deixam cicatrizes emocionais duradouras. Indivíduos que vivenciam esses desastres estão lidando não apenas com uma perda imediata, mas também com ansiedade de antecipar a calamidades futuras, ocasionando assim a eco-ansiedade.
Hello, everyone. I'm Paola Rabas. Milena said I'm from Uruguay. I'm a family and community doctor, and it's an honor for me to stay here with you. And we have various experts and stakeholders from different sectors, and agricultural, and yacht, and migration, and online we will have the Andrea Hurtado from Health Without Harm from Mexico, and from PAHO online also. We missed the academic representative, is Estela from Peru, from the Cayetano Heredia University. We encourage you to look for the first Lancet Countdown report from South America, and this is available, and it's her work, so we invite you to look for it. So we start with Andrea. She's online, and okay, I don't know if it's okay to start right now. Welcome, Andrea.
Hi, I think it says that the host has stopped my video. Let's see. Here we go. I hope you can all see me now. Yes?
Yes.
Okay, great. And can you hear me correctly?
Yes, we all listen to you.
Okay, thank you so much. Thank you, Milena. Thank you, Paola. And thank you, everyone who's at the WHO Pavilion today to listen to this regional approach to health loss and damage. My name, as Paola said, is Andrea Hurtado. I'm the Climate Program Manager for Latin America at Healthcare Without Harm. And I am very happy to talk to you about this issue from the perspective of health systems. And before we get started, I want to provide a bit of an introduction to loss and damage and how it affects our health, or how it is reflected in our health. And first of all, when we talk about loss and damage, we're discussing losses and damages derived from climate change and from its impacts, but this is a reflection already of either an absence or a failure of mitigation and adaptation policies. These are the unacceptable consequences of our inability to mitigate fast enough to avoid the worst effects of climate change, and our inadequate preparation to face the already inevitable impacts that we have locked in through decades of unlimited emissions. Even when we have tried our best, we need to understand that loss and damage occur when we have reached the limits of adaptation. So when it comes to health loss and damage, the most obvious examples that come to mind are direct injury and illness resulting from extreme weather events. The extreme weather events of the past couple of years have made us see firsthand how our health is directly threatened by a changing climate. But to really understand the complexity and the dimension of health loss and damage, we have to look deeper. We would characterize a loss when the affectation is irreparable or irreversible. For example, if we lose a limb or the most irreversible loss of life. There is damage when there is technically a way to repair it, but I do want us to think that even when there is a potential way to recovery, that does not mean that there are no other losses involved. So for example, we may have sustained an injury that we can recover from a storm, hurricane, forest fire, you name it, but we might lose our job or our livelihoods during the recovery period. So there might be technically a damage to our health, but there is an additional loss that we need to account for. We might also have sustained damage to our mental health through post-traumatic stress disorder or other forms of emotional trauma, which we should not underestimate. So we need to understand that, yes, there can be a direct affectation to our health from an extreme weather event, but there can be many indirect ones that we also need to account for. To give you an example, after the massive forest fires in Canada that we had this year, you might all recall the giant cloud of smoke that covered large parts of the United States and even further south. And there are numerous accounts of respiratory complications from breathing that toxic air. So health loss and damage is not limited to the localized area where an extreme weather event may occur. We also need to talk about the multiple losses and damages that are related to not just extreme weather events, but also slow onset events that are being aggravated by climate change, such as desertification, sea level rise, even the amplification of the distribution area of climate-sensitive diseases, particularly vector-borne diseases, which we're seeing now in latitudes where we would never see them before. And this is because of temperature rise. These may be more indirect impacts, but they are no less important or severe, because we need to understand that it is not just our current state of health that is affected by climate change, but also the social and environmental determinants of health that allow us to sustain our health over time. So I won't go into more detail on slow onset events because the speakers that will take the floor after me will do so from key perspectives, such as how climate change is affecting agriculture and thus our livelihoods and our nutritional health. But I do want to bring a final element to this greater complexity of loss and damage, and that is that we have both economic and non-economic loss and damage relating to our health. While there are many quantifiable health losses and damages for which we need to secure funds so that we can react accordingly and we can compensate wherever possible, let's not forget that the loss of life, the loss of our inner peace, the loss of a limb, maybe a chronic illness that we may have to live with for the rest of our lives, these are unsurmountable losses and damages for which no amount of funding will ever make up. So having given this broader perspective, when we talk about health loss and damage in the health sector, we need to understand that everything that I just mentioned amounts to an increasing demand for health services. And this is putting an increasing amount of pressure on health systems that are already overwhelmed in most of the developing world. So because this is a panel that brings the perspective of the Latin American Caribbean region, I will speak of those health systems where even before COVID-19, they were already struggling to secure the most basic products, sometimes even being able to provide coverage of essential services to their populations. After 3 years fighting a global pandemic, these health systems are ravaged in many cases in most of their region, and especially public health systems. So climate change is creating this additional demand on already strained health systems. And when we discuss loss and damage in the health systems, we need to understand that, yes, of course, we need to look at the population that we're attending to, but we also need to think about the health system's own personnel, that is the health and safety of the workforce, the health workforce. We need to consider the losses and damages occurring in the operations and the supply chain of those health systems. What happens when a health facility loses access to power, for example? What happens when the supply chain is disrupted by, say, for example, closing of roads from a particularly strong storm? Then lives are at stake when that happens. And then finally, we also need to understand there are losses and damages occurring to the health system's infrastructure. And when you consider that whether it be a slow onset event or an extreme weather event, the final building standing needs to be the hospital or the health center, then this is particularly serious. So the health sector has always been viewed as one that is particularly vulnerable to climate change. We must also make sure that it is a priority when it comes to responding to loss and damage, because it needs to be the first to stand right back and to rebuild after a climate change impact. And so to wrap this up, I did want to bring an example. Some of you might have seen, I think it was the day before our health day, our first health day in the setting of a COP, which happened on December 3rd, that there was this important article came out in The Guardian, in the newspaper The Guardian, and the headline read, "Extreme weather could shut down 1 in 12 hospitals worldwide, report warns." And it talks about more than 16,000 hospitals worldwide that are at high risk of completely being shut down unless we act on climate immediately, particularly by phasing out fossil fuels by the end of the century. And the image that you can see in that article, if you look it up, if you just Google extreme weather events could shut down 1 in 12 hospitals worldwide, you will see it. The image is from a hospital here in Mexico. I'm sorry, I did not say I'm based in Mexico City. And this happened in September of 2021. This was a public hospital in the state of Hidalgo, in the city of Tula, that has a river, and because of very high precipitations, unprecedented precipitations, the river went overboard, and flooding basically took over the entire city. What I want to bring to our attention when we talk about loss and damage in health is that health crises and the environmental crises go hand in hand, and they're mutually reinforcing. So what happened in this case is that they had several patients that were hospitalized because of COVID. And so the flooding caused the hospital to lose its access to power. So they lost electricity. 17 people died because they could not bring the power back. They did not have an emergency backup, or the emergency generator, it failed. And so 17 people died because they were connected to ventilators because they had COVID. And so what this example from our region brings to the table is, first, we have completely failed at adapting. There were no early warning systems to let the health system know that this potential flooding was coming. There were no evacuation protocols. We even have some accounts of the health workers from this hospital using their social media accounts to call out for help, to see if there were hospitals around the area that could take their patients, their more critical patients, and no one responded. There was no coordination between different levels of government to respond quickly and effectively to this situation, and evidently, the most basic functions or operations of the facility failed when there was no emergency generator that could keep the electricity going for these 17 critical patients, which tragically died. So what we're already seeing, and we're going to see more of in the future, is health facilities being taken to the limit. And please bear in mind that this is with a little over 1 degree Celsius in overall global temperature rise, global average temperature rise. There is no health system that can adapt to a world of 2 degrees, and especially not to a world of 3 degrees. If we reach that, there is no amount of adaptation that we can do that will prevent this kind of loss and damage. In the Latin America region, which is also the most unequal region in the world, one where access to health is still lacking in the most basic services, and where with one of the highest rates of out-of-pocket spending to access health, this is a recipe for disaster. And so my call to wrap up my intervention in this COP28, where health has been really put at the center, is that we not only make sure that the newly operationalized loss and damage fund prioritizes the health sector as one that needs to get back on its feet immediately after any kind of climate impact, but that we also make sure that we're investing now on adaptation for the health sector, which includes both the current installed capacity and also the new developments that we will surely need to be investing on in the future so that we can make sure to have universal health coverage, where we're completely lacking in our region still. And so it is a call for solidarity, but it's also a call for justice, because the most vulnerable people who are already seeing their health affected by climate change will have to rely on effective access to high quality and affordable healthcare if we're ever to have resilient communities. I thank you very much.
Thank you, Andrea. It's so impressive, your words. Okay, next up, we will hear from Carol. Carol, you may introduce yourself. I think it's better because everyone know better what it's good to hear from themselves. So Carol will talk about agricultural loss and damage related to health. So thank you.
Thank you so much. My name is Carol Franco. I'm a senior research associate at Virginia Tech in Virginia, United States. And I'm also the advisor for nature-based solutions of the Ministry of Environment of the Dominican Republic. And as such, I am the lead negotiator of the Sharm el-Sheikh joint work that we have on implementation of climate action on agriculture and food security here at the UNFCCC. Yes, I would like to talk to you a little bit about agriculture, the impacts of climate change on agriculture, but also how it relates climate change, health, and agriculture in that sense. And where the food security and where those food security would fit into the loss and damage, which is not there as of yet, at least not explicitly so far. And there was in the video at the beginning there was mentioned about the rains that we just suffered at the beginning of November. So we receive around 431 millimeters of precipitation in less than 24 hours. Preliminary data says that we lost over 87, there's a cost of over $87 million in agricultural losses. Preliminary data, so we don't know yet what's going on, but that's the numbers we have. And those numbers are extremely impressive. And this goes back to climate change, what's happening with increases in floods, increases in droughts, and increases in temperatures. And this is how we get to the health piece of it. And it's increases in food security. What's going to happen to food? What is happening to food security because of those extreme weather events, which is what we suffered in early November. And at the same time, there is a report just coming out from the World Bank that I had the honor and privilege to support, and it's called Climate Development Report, Climate Change Development Report, CCDR. And in this report, we did some modeling as part of it, and it talks about how heat waves are going to decrease agricultural productivity, because if it's so hot, you cannot be out there working on production, crop production. So this is how the way we look at it as, okay, we have climate change, we have the impacts, we have the extreme weather events, slow onset events, and how those impacting the agriculture sector, which in turn impacts our food security, and it will increase hunger, it will increase malnutrition due to climate change. Now, my link, one of the things that we need to do, and it's extremely necessary, is we need finance, we need capacity building, we need technological transfer, and I keep saying that, and those are some of the means of implementation that we talked about here in the negotiations. We need that framework in order to have more information, more data, more research. A lot of what's out there for finance and financing focuses on implementation, but you cannot implement if you don't know what's going on. And you cannot implement if you don't have accurate data and reliable data. And the Dominican Republic is working really hard on it, but we still need a lot of that, a lot of what I call basic research. in order for us to be able to then implement and develop the right policies for that. So we're working on it, but we still need that framework, which is what we are trying to achieve here at UNFCCC related to the work in agriculture. Also very important for us in the DR and agriculture sector and health is adaptation, because at this point, we need to be able to adapt. So extreme weather events are going to continue to come. They're going to increase in number. They're going to increase in intensity, just like hurricanes. So what are we going to do? The only way out is we need to adapt. I'm not saying we're not mitigating. That's part of our Paris Agreement. It is there. But what are we going to do to adapt to ensure food security and ensure that we decrease malnutrition and hunger in the country? Related to that, then, I talked to my lead negotiator for losses damage, Camila Rodriguez, basically talking about, okay, so where do we fit? Because I was exactly looking at non-economic losses. And I was like, okay, I can see here ecosystems, I can see excellent, biodiversity, excellent, health, perfect. Where is food security? And we just started discussing, it can go straight under health. So we can put, because that's where it's going to be. When we're looking at these non-economic impacts, we can see health, and then as part of health, there is food security, because that's how we're gonna be able to, that's how it's gonna happen. We're not gonna be food secure, that's gonna impact your health with malnutrition, with hunger, etc. And the idea is now, how can we start working on that under the WIM to, yes, you're gonna kill me, under the WIM, and how can we start pushing for those topics little by little, just to make sure there is a presence there for us to start building on it, which I think is extremely important. And we won't be able to do it in one day, but need to start working on it, create those reports, create that research, put it there, and I am sure, we are sure that we're gonna catch the attention of everyone, because this is an issue that it's important for all of us. And I'll leave it here, and thank you so much.
Thank you, Carol. And unlucky she is leaving this afternoon, so in a moment she will not be here anymore. So we are next to our migration expert. He is Manuel Marquez. He's the head of Migration, Environmental, Climate Change and Risk Reduction at the International Organization for Migration. That is right? Okay, so thank you.
Thank you, and thank you to the panelists and the colleagues. I will jump into this because I know Carol has to leave, to say that I cannot agree more with what she said. From the migration point of view and thinking migration broadly than what people think around international migration, talking about national migratory movements, displacement, the health questions and the food security tie very closely with the livelihoods of individuals and the negative drivers that force people to be displaced, right? We know that the collapse of the ecosystems and then the lack of food security creates, and then livelihoods from which the food security depends, create propensity for people to move, and move in ways that are not safe, they are not informed or dignified. And that and the consequences of health of these people moving, or when they arrive something, their exclusion from the health systems, because the health systems cannot cope either because they move to the periphery of a city and they are not part of how the state manages the individuals on a geographical area for a hospital, or they cross a border, or they move to some place where there are no capacity, right? In many places around the world, in informal urban areas, we are seeing that the health services have not been able to grow commensurably with the increase on population. So we do not have the right scale, the right level of health services for the number of people that exist in a geographical area. These people are invisible to the system. They don't pay taxes, they don't have an address. So the planning processes are very exclusive, exclusive, no, not exclusive, exclusionary, if this is a word in English, from this invisibility, right? And the informality of labor, the informality of access to health. What our colleague said, the pay from your pocket, it's the first point of informality on the and insecurity of health system. So from the loss and damage point of view, all of these things are things that we are very worried. IOM, despite this, well, despite this side of the migration management, of course, is very important to us with migrants, but on the other side, we are one of the largest humanitarian agencies, and we have the global mandate to help governments manage displacement. And so health in displacement, irrespectively of the agent that delivers that together with governments, needs to be coordinated so that we can guide people to those health services. And so there's a large conversation in IOM about loss and damage and health. And I think that the first intervention cover a lot of that. My advocacy to my health colleagues has been, what's the thermal comfort of health facilities and their resilience to weather impacts? It's going to be too hot in many countries for people to be in recovery or being administer medicines and other forms of treatment without ventilation. Are we going to do this with generators? It should be with solar. It should be with passive architecture that allows thermal comfort for the patients, for the workers, the waiting areas. And I used to work in Cox's Bazar managing the refugee camps, and the health team was amazing. And we built 20 new hospitals. And then I went there and everyone had forgot the waiting areas because everyone was so worried with what happens inside that everyone forgot that it rains outside. And then, of course, it was retrofitted and they were added. But I think these processes, and especially the loss and damage dimension on these, the planning part of loss and damage. Planning for loss and damage is adaptation, but having the capacity that the response to loss and damage delivers on these angles is very, very important. And I'm very happy that you bring these conversations to the VIM. I actually sit in the VIM, but on the task force on displacement. And I think health for people already displaced and for many vulnerable communities around the world, it should be our worst concern at this moment, right? I will just put on the table so that I don't elongate my intervention. We are not thinking enough about the offshoot period and what are the values of temperature on the offshoot and what's the impact on that. The IPCC report is important, but the only substantive point is on Annex 10, where it predicts that between 2041 and 2061, a large part of the world will have areas that will be more than 100 days a year above 35 degrees of average temperature. This is a killer for ecosystems. This is a killer for the wealth and welfare of people. And many of these places are places where we already have refugees and IDPs and migratory routes and very fragile health systems. So it's time to bring that dimension of mitigation is not where it should, adaptation is lacking. What's the offshoot? What are the health consequences of that, the mobility consequences of that, the protection consequences of that? And then we can start bringing the finance and the conversations about some of these points. But I will leave it at here. That would be my appeal and this broader lens on this conversation. Thank you.
Okay, the intervention make us a little sad, but we are here to go ahead. Keep pushing. Okay, so we turn to the next panelist. He's Marco Cháñez. She's from Chile, and she's from the Santiago Network, so he will explain better than me what is his work and why he's here in Loss and Damage panel. Thank you.
Thank you very much, Paola. Yes, I'm Marco Yáñez from Chile, a climate negotiator, and I was also a young negotiator at COP26. Somehow I'm still in the Chilean delegation working. And I have a link with all of your interventions somehow. I wrote my law thesis about climate migration in Chile, and I'm working on loss and damage now. not on the loss and damage fund, but on the Santiago network, which is to catalyze technical assistance for the countries that are needed that. And yeah, when I was watching the video at the beginning, I was thinking, well, I also saw Viña del Mar, which is in Chile, and right now we're having fires there. And I was thinking at the negotiations, or at the meeting rooms, we really need more of these videos. It will be amazing to start every session of the negotiations with a little bit of inspiration for all of us. It seems that when we are working on the paragraphs, on the commas, we are thinking more about, okay, where the office is going to be. We were deciding the host of the Santiago network, and then the location of the Santiago network. And what about the people that are going to receive this technical assistance? So Chile wanted to bring this to the people, to talk about, okay, human rights, vulnerable population, and I think there's a lack of that conversation. Yeah, so that's why I was thinking, yeah, we need these videos at the beginning of the negotiations. There's a problem, let's say, there. We spent a lot of time talking where we want this, how we're gonna do this, and missing, okay, but who's gonna receive this help? And it's people in the end, the people that you can see in these videos. And yeah, the Santiago Network for Loss and Damage was created at COP25. And in that time, we knew all of these problems, and after COP25, it was just a website. And I think that's not okay. That's not okay. So at COP26, as a young negotiator, I think we have the responsibility to be more like, to push more, as you were saying, and try to get some fresh air, try to bring some fresh air to the meeting rooms, and to challenge, to change a little bit the way that things are in the moment. And so we were working on the functions of the network at COP26, and I think in that moment we wanted to finish with the network and to start with the operation of this network to help people. And we're now at COP28, and we're waiting for the same. So I think that's the proof of how slow the negotiations are. And as I was saying before, starting this panel, that this is one of the best negotiations that are taking place here at COP28. It's a friendly environment. It's one of the negotiations that you can see more progress on. And still, we really need more and more and faster work. So yeah, I don't know if I'm missing something or if I can receive more questions about this, but I'm a little bit critical with the progress that we are doing here, because when you watch these videos, you really need to think about these people. And when you're in the meeting rooms and you spend hours and hours talking about the paragraph, comma, and you forget that there's people outside waiting for this, I think that's not okay. But hopefully we're going to have better results with more youth engagement. The good thing, I also have good news, of course. I don't want to be so negative about this, but Chile has a youth program. Every year, the Chilean delegation is bringing 2 young people to work on the negotiations. And this year, we have 4 young people. 2 young negotiators, new young negotiators, and 2 old young negotiators, and I'm one of them. Yes, thank you very much.
Okay. Thank you, Marco. So you give us a hopeless. Okay, we will turn to Daniel. I don't know if he is with us. Yes. So Daniel Boss is, okay, bye, Carol, thanks you a lot. Is the unit chief of climate change and environmental determinants of health of the Pan-American Health Organization. So thank you, Daniel, to be with us. Your turn, sorry.
Thank you very much, Paola. I hope you can hear me well. And I'm missing my time in Dubai. Thank you so much for having me virtually as well. Unfortunately, I have to come back to Washington, D.C., but I'm happy to be part of these discussions. So very quickly, and I was hearing the whole panel, very interesting presentations. Thanks for sharing. This is very useful and helpful for the region of the Americas. So as you know, the COP28 had 129 countries signing the Climate and Health Declaration. That's unprecedented. That's putting us on the right track for the following COPs, where we are planning to have potentially a global resolution. But at the same time, what I want to flag are the opportunities that we have in the near future. So in May next year, that it will be presented during the World Health Assembly, a new global resolution and plan of action on climate change and health that is being presented by countries globally. And in the Americas, specifically at the Pan American Health Organization, we are preparing a policy for strengthening health sector's action for climate change and health equity. So I think that many of you touched and addressed this topic of the importance of climate change affecting everyone, but affecting people in different ways, and disproportionately affecting persons in situation of vulnerability. And I think that that's our commitment now as the Pan American Health Organization, to really, first of all, map and understand who are these people, and secondly, develop tailored interventions, policies, and activities for these populations who are marginalized, as many of you said, and lacking the proper policies, lacking the proper interventions to change their lives and improve their lives. So I'll quickly address some of the main topics that are in these resolutions and PAHO policy, so you can help us to build this together in the region of the Americas. We count a lot with the support from our member states, but we also count a lot with the support from civil society, academia, and so many other important stakeholders. I thank a lot GCHA for opening the space and the opportunity to be here with you today. We count on their support as well. Healthcare Without Harm is a long-time partner of our units and our teams here in the region of the Americas. So we really count with your support. Paola and so many others have been instrumental to push this agenda forward in the region of the Americas, and I'm very thankful to be part of these efforts. So one key topic for us, of course, is going to be under the mitigation, the electrification of healthcare facilities. So reducing greenhouse gas emissions from healthcare facilities and from the whole productivity chain of health. So hospitals account for about 1/3 of emissions, the whole productivity chain for 2/3 of emissions from the health sector, which can account for something 4 to 10%, depending on the country, of national greenhouse gas emissions. So we do have a very important role to play in terms of mitigation. But what we want to do in the Americas, given the big deficiencies that we still see in healthcare facilities, is also to take advantage of our great programs and teams here to work on WASH, water sanitation and hygiene in healthcare facilities, indoor environmental air quality for healthcare facilities, chemical safety, so eliminating the use of mercury in thermometers, lead in paints, and so many others, and doing a proper waste management program in those systems. So we really need to not only, or using the opportunity of using green energies to electrify healthcare facilities, but also advancing on some of the gaps that are still existing in the region of the Americas. We talk often about the future trends, the future impacts, but we cannot forget that in the region of Latin America and the Caribbean, we still have a lot of people who are left behind in terms of access to clean water, access to safely managed sanitation, exposures to chemicals, and lacking proper waste management in their communities. And they don't have the proper access to health care. So we need to address those things in tandem if you want to really make the difference in terms of climate change. And on that note, on the adaptation side, what we need to do is to increase the resilience of health systems. And I say health systems in the sense of a broadened term, not only including health sector, but also many sectors that contribute to health. So we heard here about migration, we heard here about food systems, we heard here about the role of the health sector, and I think that that's the right approach. So we need all hands on deck to deliver the highest standards of health for the population, especially the ones in situation of vulnerability. So we are building with countries of the Americas observatories on climate and health that in its more sophisticated version, we would have the development of early warning systems. So we have agreements with UNEP, with WMO, and many other, UNICEF and other agencies, UN agencies, and also academia and civil society, as I was referring to. But what we need to guarantee is that those early warning systems, they can trigger early action within health sectors. Because what we are seeing is that many early warning systems are being produced, the warnings are being issued, and the health sector has no capacity of responding to them. So we really need to know in advance, and I agree about that, but ideally we should know way in advance what's happening. So if we can, for example, anticipate where dengue is moving next, and we have plenty of candidates and we are monitoring those areas in the Americas, for example, the southern part of Patagonia in Argentina and Chile, since we have two colleagues, one from Argentina, one from Chile here, where Aedes aegypti mosquito is moving next. And we are able to identify that in 18 years of entomological surveillance, we found that the mosquitoes Aedes aegypti were able to complete its cycle for 12 consecutive weeks in March this year because a prolonged heat wave in that region. So now we know very well what is the threshold of temperature that the Aedes aegypti mosquito would need to thrive in the southern cone region of South America. So increasing the number of people who can be affected potentially by dengue, Zika, chikungunya, and other diseases that can be transmitted by this specific vector. And we are doing this monitoring and mapping of other vectors and also other affections like heat waves, which we are going to put a lot of our effort from PAHO to start a big program, a systematized program on heat and health in these next 2 years. So how to do that? How to make sure that health is climate resilient or increase the climate resilience of health systems? We need better staffing. Health sector is already overburdened with existing deficiencies, as I was referring to, and we really need to make sure that health is able to incorporate these new warnings and be able to respond. So we really need to strengthen health sector's capacities on training, on primary healthcare, on lab capacity, to identify which viruses are circulating, and do quick analysis of wastewater, prospective analysis of what might come as new viruses or new diseases that might be reaching new areas, either going up the Andes or south in the southern cone of South America, or changing their behaviors and distribution because of the changes in temperature, humidity, precipitation, etc. We need to have risk communication tailored to communities where they can quickly understand what's happening and be able to support health systems in preventing those things from happening. That's our main goal, is trying to anticipate and prevent things from happening. But when things are impossible to prevent, we really need to have a systematized approach for quick health adaptation response and quickly recover from climate-sensitive diseases and events. And lastly, we need to work with all sectors as we were talking. So there is something that was conventionated as health co-benefits of actions that happen outside of the health sector. For example, investments in cities, in active and smart transportation modes, on green urban spaces, food systems, air quality improvements, etc. But for us, the importance is that all sectors are having these health lenses when they decide for policies and interventions. So improving health and preventing health affections should be put on the table when other sectors are monitoring and deciding on which policies and investments they would make. And the co-benefit is the climate. So we need to secure that our population has good health. And in doing so, the co-benefits for climate should be also looked after in terms of pushing the health systems and pushing for a healthier lifestyle and healthier society. That's the key goal that we want to also to promote and to call your attention to. So thank you very much for having me. Thank you, Alexandra, Karine, and Emily, our colleagues from WHO who are running this WHO pavilion. Thank you, Milena. Thank you, all colleagues for having me today.
Okay. Thank you, Daniel. So the time is running. So just I like to add something because I heard Daniel mention primary health care. So I am family physician and I have to say primary health care is the most sustainable part of the whole health system. And family physician, we are close to the communities, close to the family. We know what is happening there, what are the actors who organize, how we can organize the community, and it is the early warm system in the communities. Well, so we prepare some questions, but it's not time enough for this. So I ask you if you can say something for summary, something you want to say. And we thought also, and I want to highlight this because I think it's important talking about loss and damage. The loss we can know only the non-economic loss, the intangible losses, the cultural losses. When people have to move from where they live, they move with their own cultural heritage. I mean, the food, the music, the oral traditions, and this is a very important losses that we don't talk enough, I think. So I give you the microphone, and you said something you want to close this panel. Thank you. And for you, Andrea and Daniel, thank you, Andrea, for stay with us until the end. So,
well, it falls to me. So I'll make two very short remarks. The first is, I think we don't talk enough about non-economical losses. There's a bit of a paranoia of putting a currency sign in front of everything, because then you can say how much it is, and because there's not enough money available in the world, you cut it 2/3 and then you put it aside and check the box, the money was alleviated. Not everything is about money, not everything should be about money. Bhutan does not express the growth and the richness of the country in money, measures it in happiness. I think that's a very good guide for us in many things. And the non-economical losses are the same, right? To indigenous communities, to communities in islands, and communities in places that the ecosystem will disappear. And when they are extremely connected to the ecosystem, it will have severest consequences on their health because of the change in food consumption, but also mentally on the way we relate. We that live in cities, at least I talk for myself, we dissociate ourselves from nature. So it's us and nature. And many people around the world still live with nature. And I think that's an important thing, but it's a mind state. I've heard an activist of the Pacific say something that has been stuck in my mind in terms of loss and damage. She's saying, I'm against the definition of seeds, the small island development states. We are now calling ourselves BOSS, big ocean states. And then this is extremely powerful because we need that change in way we see things. It cannot be just money. There's much more than that. And fighting these non-economical losses is pushing back on the lack of ambition on mitigation, because we are saying that is not enough. What's being done is not enough. So we will not arrive to extreme of loss and damage. We will not have to fight for adaptation. We get climate justice by pushing back. And I think that from the psychological point of view, it's where we need to go. And from displacement, that to me is the line. No one should be displaced. It's immoral that people get displaced. So we need mitigation to solve that. We should not arrive to loss and damage. Sorry, it's a bit of insisting on this, but I think this forum and is online. These are the things that I think need to be said in line with what our colleague says. Countries need technical assistance for loss and damage because we have gone too far on our lack of ambition and on mitigation and on our adaptation. And I'll stop the militancy here. Sorry. Thank you.
Thank you for that. I agree. I fully agree with what you said. And just to add that, it seems that at some point the negotiations are going to be just about loss and damage. Mitigation, it's there, and the same with adaptation. But you can see that loss and damage now is like the main thing. We are working on the loss and damage fund, and I think that's not the answer, and we are very far from the solutions, and we all know that time is running out. And now we are thinking about people, for example, from Tuvalu, that they need to move, and there's climate migration, but we don't have this concept of climate refugees, for example. It's not there. International law is not recognizing this yet. And with your question, I think it's very important that what's going to happen with the language, the culture. So I think there's a double responsibility here. There's going to be a country that's going to receive people, hopefully. It's going to receive people that are forced to move, and they need to host in a way these values, this culture, this language, the food. It's a lot that they should protect, but at the same time, the double responsibility comes from the people that are moving. They need to preserve all of this. They need to have a commitment that, okay, even if we are moving to a new place, we should try to preserve all of what we learned in our home country, in our homeland. And I think that's a challenge, a double challenge from the home country and the country that is hopefully receiving these people. And so I think we should move into the recognition of climate refugees, in my opinion, because it's a concept that is already there. It's already here with us. And so thank you very much for this amazing panel. Thank you for the remarks that our speakers online also mentioned. Thank you very much.
Thank you, Marco. Andrea, do you want to add something? Okay.
Yes, thank you very much, Paola. And I will only join my fellow panelists in thanking the WHO for hosting us at the pavilion today, and Milena and everyone at the Global Climate and Health Alliance for convening the Latin American and Caribbean network that on climate and health that has made this event possible today. Just final words, building on what we heard from our colleagues in the panel. Yes, we need to make sure that resources from the Loss and Damage Fund and technical assistance from the Santiago Network are flowing to the health sector, particularly public health systems in the developing world, so that we can make sure that the provision of healthcare is never disrupted. And if it is, that they can get back on their feet as soon as possible. But as has been made very clear by this panel, we cannot rely on loss and damage response if we're not simultaneously doing everything we can to reach net zero as soon as possible. Because as I said, there is no health system in the world that can withstand the impacts of a 3-degree world. And also, yes, there are limits to adaptation, but we're nowhere near reaching them. We need to mobilize massive amounts of funding, secure technology transfer, and build capacity to adapt our health systems as much as we possibly can, based on comprehensive vulnerability assessments that cater to the complexities of health systems, considering, as I said, both the populations that we tend to, but also the health system's workforce, their operations, their supply chain, and their infrastructure. We need to make sure that all health facilities are connected to epidemiological and meteorological early warning systems. We need to make sure that their personnel is trained to respond to multiple crises, following pre-established evacuation and other response protocols. We need to make sure that the infrastructure is reinforced, refurbished, or in cases such as the one that we just heard from the panel, where there are cities that will be over 35 degrees average temperature for 100 days of the year, maybe even completely relocated. We need to make sure health systems have access to emergency funds and insurance. Insurance is key here. And these health facilities are becoming increasingly uninsurable. So this is obviously a non-exhaustive list, but there is so much more that we can do before we get to the point of accepting loss and damage. And so my point is, the health loss and damage that we're already seeing and the worsening that we're anticipating, it's unacceptable. We need to prepare to respond to it, but mostly we need to work on how to avoid it as much as possible. Otherwise, we're choosing to halt and even reverse decades of development gains everywhere, but especially in the global south. And let me end by saying that when it comes to public health, one key lesson that we learned from COVID is that we're only as strong as our weakest link. We accept health loss and damage to our own detriment. I hope COVID has taught us enough that we may rise to the challenge for everyone's sake. Thank you.
Thank you. I don't know, Daniel or Milena, maybe. Okay. You, Daniel. It's your turn.
Thank you, Paola. No,
to the end.
I agree with everyone, and I'm really touched by everything that each one of you said. I totally agree. But I'll maybe add one dimension, because I think that your question, Paola, was spot on. Not everything in loss and damage can be measured in dollars, in money. And if a indigenous population is forced to move away from the land of their ancestors, or the sacred tree, or their sacred rivers, that cannot be accounted for in terms of monetary values. So that's a very deep discussions that we are having actually on this whole loss and damage thing, which is the ethical component, and putting dollars close to an ethical component, and it's never good. I mean, it's never going to complete and make everyone satisfied with that. But also the loss and damage mechanism should not be seen as kind of a check that exempts you for every single responsibility that you have, including the ethical responsibilities that you have. So I think that that's a very critical discussion that also lies in the heart of the equity and health equity component. So regardless of these advances that we are having in those discussions and loss and damages, I think that we really need to go back and think of the way that we are producing, consuming, distributing those resources all over the world. It's the region of the Americas is the most unequal region in the world. And while this continues to happen, all these inefficiencies in health sector, inefficiencies and lack of distribution or equitable distribution of services and products are going to continue. So we cannot accept that. That's the key thing, is the way that we live our lives. It's not just climate change or not climate change and putting dollars in front of everything, but rethinking the way that we produce, we consume, we relate with nature. And I think that that's at stake. And we really need, as a human society, a global human society, rethink many of these things. I think that maybe this will sound kind of a very far from the nitty-gritty of reality, but I'm convinced that, and I've seen the recent report of the limits of ecological limits, right? So the pushes in the ecological limits that was recently launched in this COP, and it's staggering. So we cannot really continue to produce, consume, and advance as a society the way that we are. And that's the key bottom line for these discussions. And the ethical components of not letting an island disappear, or indigenous people having to move, or people who are in the peripheries of cities suffering so much from climate change and from the exclusion. That's the key topic that we need to address.
Completely agree with most of the you are saying here. It's we have to change how we walk by this planet because there is no B. And thank you very much, all of you. And I don't know if someone from the audience want to comment something. Milena will kill me, I know, because we are out of the time, but it's okay. So, Milena, no, it's okay.
Just wanted to thank you. Now I'm going to speak instead of the audience. No, but it was fantastic to have all of these perspectives, and we have just opened the conversation on loss and damage and focusing on especially the Latin American region. So I hope that we will keep convening and talking and working together. We need to add our missing academia, also youth, indigenous knowledge, and try and figure out this big solution that we want to be part of together. So thank you very much, everyone who joined in person, online, and to our distinguished panel. And goodbye for now.